Hello friends. We have completed a brief introduction about air pollution. So, with that background now we proceed for looking at different important aspects of air pollution like impact of air pollution on human health. So, that we can appreciate why it is important to study air pollution and why it is necessary to control the air pollution. So, today we will discuss about human health impacts of the air pollution. First of all, like in this content list, it is shown that we will see why this air is so important for well-being of human life, and then the major concerns plus short term and long term effects of air pollution, plus we will see that which population groups are susceptible to the ill effects of the air pollution, okay? And then factors which affect the human health, and the human health impacts kind of pyramid, like certain diseases are there in large number of the population, and then severity of disease increases, but the population number decreases. Okay. Then the common pollutants affecting human health, we will look at their properties, and the health effects of specific air pollutants like SO2 or particulate matter, what are their specific health impacts, we will see that, and then we will conclude accordingly. So, now we see why this air is so important for comfortable survival of human life, to support the human life. So, you see from this particular chart, 15 kg of air is needed every day for an adult person, and around 1.5 kg of water is required, and 0.75 kg of solid food is required. So, you can see like twice of the solid food the water is needed, but 10 times of that water quantity or 20 times of the food quantity we breathe air every day. So, that means the exposure, exposure, if there is any pollutant present in the air. So, the exposure chances of that exposure or probability of getting exposed to pollutants will be very high if the pollutants are present in the air, because of the huge quantity of air we breathe, we inhale and exhale. So, the contact, the total duration, and then the quantity or concentration that makes the dose, as there is a saying that in this world nothing is poisonous, but its dose which makes the poison fatal. Okay. So, this dose or duration, because of huge quantity of air which we breathe, makes it very important, and it is also you can see intuitively that without food we can survive even a week, okay? Without water maybe 2-3 days, but without air within few minutes we will be unconscious. So, air is most important part of human life. Well, the concerns of air pollution related aspects, when this at the world level started. So, WHO organized one conference, and the Director General of WHO, World Health Organization, called air pollution as a silent public health emergency and the new tobacco, because over the years, because of awareness, health awareness, public awareness, people have started to decline or in number those smokers population. But at the same time, because of this urban air pollution, because of industrial clusters air pollution in ambient air or even in indoor environment, there are several sources of air pollution. So, this passive smoking kind of thing has happened, and even if people are not smoking cigarettes or tobacco, but they are inhaling the pollution from the polluted air, polluted environment. So, this is as bad as smoking. Well, when we talk about short term and long term health effects, so you can see like any air pollutant has some sort of health effects. So, maybe exposure to certain air pollutant can cause headache, okay? It can also irritate our eyes or nose, and then we can have dripping nose. Those people have some allergic to certain pollens or air pollutants. So, they have this kind of problem. Then coughing is there, like throat infection happens much more when air pollution is there, and pneumonia, bronchitis, skin irritation, all these kind of things may happen in short term, but in long term even like carcinogenic elements can cause cancer, some heart diseases may happen, or asthma, respiratory related diseases may be there. So, those kind of things are there, even reproductive organs are affected by air pollution. There are latest research about this. So, these are the short term and long term effects of health effects of air pollution. And when we talk about the susceptible population because of air pollution, so the children means, that means those who have less immune system, the immunity is not so strong, like children or old people, or those who have certain diseases, or even like females who are exposed with the huge quantity of indoor air pollution because of cooking in not good ventilated environment. So, those kind of population are the more susceptible to air pollution exposure. Well, when we talk about major factors which affect the human health, then in terms of air pollution. So, we have to see the nature of pollutant, because the same concentration of particulate matter or sulfur dioxide or NOx, they will have different effects. Okay. So, the nature of pollutant is important. Then the concentration of pollutant, there may be concentration very low. So, it may be bearable. Our system has been designed like that, that certain pollutants below the threshold quantity, they may not have very severe effect on our health. It is reversible kind of thing. Then the duration of exposure, as I said, the concentration and duration of exposure, when we multiply it, it is a dose. Okay. So, low concentration duration is very high, again very high dose total, or very low very high concentration for low duration, also very high dose may be there. So, like acute exposure happens when some accidents happen. Okay, like Bhopal gas tragedy we discussed. So, that pollutant very high dose was there, for short duration even public got exposed, but they got affected severely, right. Then the state of health of the receptor, healthy people may survive even if there are high concentrations of pollutants, because they have good health, they have good immunity, right. But those people who are already ill, already diseased, so their immunity may not be so good, and they may fall prey to the air pollution very severely. Then the age group of the receptor, like old people, children, they are more susceptible, as we have seen, right. Then we see like pyramid of health impacts of the air pollution. So, at the bottom you can see pollution exposure. So, most of the people get exposed, the large population get exposed by air pollution. Then the physiological changes or subclinical effects happen to some people, not the complete. As I said, some people are allergic to certain pollens, right, but other people are not allergic. So, they will not have those symptoms, but some people will have. Okay. Then the symptoms of illness and the use of medication will be done by the group of that population. So, that number will further reduce. Then the primary health care attendance will be done by lesser number. So, that way far lesser number will be admitted to hospitals if the problem is severe, and a few people may also die, again depending upon what is their health, how much they are exposed to air pollution. So, this is a kind of pyramid of health impacts of air pollution, which is quite popular. When we talk about the common air pollutants that generally influence the human health, so they are like carbon monoxide, sulfur dioxide or nitrogen oxides, ozone, particulate matter, then polycyclic aromatic hydrocarbons, PAH we call it PA, and dioxins. Okay, they are very toxic pollutants. Then VOCs, volatile organic compounds, they are themselves have damaging effects, plus they also contribute to formation of like ozone and other kind of things. So, when we see about this air pollution induced health effects, so we can see like particulate matter, sulfur dioxide, they can cause headache, or the central nervous system can be affected by very fine particle matter. Okay, very fine, very like nanoparticles can go up to the blood stream and they can travel up to our brain. That is very important to visualize. Then ozone, particulate matter, nitrogen dioxide, sulfur dioxide, those kind of pollutants, they can cause to irritation to eyes or to the nose and the throat, and the complete breathing system can be affected. Lungs can be affected by particulate matter depending upon the size of the particulate matter, ozone, sulfur dioxide, or those kind of pollutants, right. And these can cause heart effects also, cardiovascular diseases may be because of these small particulate matter, they can change those heart related issues. Then lungs can be affected by again similar pollutants like particulate matters and others. Then NO2 can even cause liver effects and in the blood, plus the reproduction system can be affected by a small particulate matter. So, new research says like that. Okay. When we talk in detail like carbon monoxide, so it is, as you know, the colorless, odorless, tasteless gas, and that is why it is known as a silent killer, because in our system if we have foul smell, then we feel irritated and we will do something to remove that, but carbon monoxide does not warn anything. Okay. You just inhale it and it will dissolve, it will get dissolved into your blood, and the carrying capacity of oxygen of the blood will be reduced and you will be unconscious and you will not know what is happening, right. So, this is very dangerous thing in that sense, and it is emitted by several sources, especially by like transportation sector. Vehicular emissions, exhaust emissions are a major source of carbon monoxide. Then fuel combustion, industrial processes may also be there, but major portion of CO comes from on road vehicles. So, if we can make the on road vehicles efficient in burning of the fuel, then carbon monoxide can be reduced, right, and it will be completely reduced if we go for electric vehicles, battery vehicles, right. So, those kind of things you can visualize. When we talk about the health effects, the particularly dependent on carbon monoxide, so you can see the dizziness or headache depending upon its concentration. Okay. This shows the concentration and its health effects. So, even it can cause death, very high concentration. So, it is very important to look from that perspective. When we talk about sulfur dioxide, so it comes from industries or shippings, wherever diesel, fossil fuel like coal etc., are burnt. So, sulfur dioxide is emitted in huge quantity like power plants etc., and that is very important to see that how can we control them, because sulfur dioxide has several ill effects like mucus secretion, it causes eye, nose, throat irritation, right, and then breathing difficulty, those kind of things. In long term you can have the respiratory illnesses, and then it can aggravate the heart diseases also. So, those are the things which we have to see. So, if we are living in the environment where sulfur dioxide is in large quantity, then these kind of illnesses one can expect or should be at risk. Well, there are issues which we have seen in the earlier lecture also, like in London smog, as you have seen in 1952. So, 4,000 people died, and the responsible factors was sulfur dioxide and particulate matter, right, and 400 deaths occurred in 1963 in New York City. So, that was also because of sulfur dioxide high concentration. When we talk about nitrogen oxide, then the sources are like these vehicle, on road vehicles, car, trucks etc. So, exhaust emissions, carbon monoxide and NOx emissions are in huge quantity comes from on road vehicles, please remember it. But other sources are also there like coal fired power stations, industries etc., and they have their own health effects like irritation to respiratory tract, or it can call some increased breathing related resistance kind of thing, maybe there, suffocation, those kind of chronic toxicity may also be there. It can damage these fibers of the lungs. So, those kind of things. So, the exchange of the oxygen to the blood may be affected very negatively. When we talk about ozone, ozone is not a primary pollutant, it is not emitted by any source, it is produced rather in the environment, okay, because of photochemical reactions, but there are certain precursors which produce the ozone in the presence of sunlight like NOx emissions, VOCs, volatile organic compounds, or hydrocarbons, and ozone production is dependent upon certain other factors. So, sometimes we call that it is VOC driven or it is NOx driven. Okay. So, we have to see which precursor is responsible for ozone production in a particular location. If you are not dealing with that particular precursor, you are reducing other precursor, maybe ozone problem will not be solved. So, those kind of things you will we will see in detail later on. You can also find other literature source for this. So, this is also again in troposphere it is very dangerous for us, it is having health effects as well as it damages the property, but in stratosphere it is very good. It is said that ozone is our friend in the stratosphere, but in troposphere it is our enemy kind of thing. So, that is we do not need in troposphere, but we very much need it in stratosphere because it protects us from ultraviolet rays, right. Well, when we talk about the health effects of the ozone, then short term effects like coughing or wheezing kind of things, when it is difficult to take inhaling or exhaling. So, when you are exhaling, then kind of sound occurs like whistling kind of things, or irritation to eyes and the nose, headache or dizziness, okay. Fatigue, you are tired, even means sometimes people feel that I am tired, why I am so much tired even if I have not worked so hard, but people do not know that it may be reason because of pollution. If you are living in the polluted environment continuously, and like sick building syndrome, that is also there. If you are living inside a building which is polluted, you can have headache, you can have sickness, those kind of things. So, we should be careful about air quality also. So, ozone can have these short term effects. It can also have long term effects like respiratory diseases, cardiovascular heart related diseases. It can harm the liver, or it can also harm the blood related things. The nervous system damage can be occurred by ozone, cancer or birth defects, death, all these are because of ozone. It is possible depending upon how much concentration is we are exposed to. Then like lead poisonous is there. You might have heard about unleaded petrol. What is that? Unleaded gasoline or unleaded petrol. Why it came into existence, or why government had this policy? Because the lead is very toxic, and it has been studied that small kids, if they are exposed to high lead concentration in air, their memory will be affected, and their learning ability will be very slow. So, those kind of things may be there. So, that is why we have gone for this unleaded petrol, etc. Okay. So, you can see the toxicity of the this lead. You can see the intellectual disability can occur because of lead concentration, or underperforming in the schools, and you might be wondering why my child is not performing very well, and you do not know that maybe it is exposed to lead. And that is why in paints also nowadays there are several advertisements of paint companies. They say our paint is not having VOCs, our paint is not having lead, those kind of things, because of this awareness. Because even if in the indoor environment you are having very good shining paint on the walls, but if it is having lead contamination, then you will be exposed to the lead, your children will be exposed to the lead. So, be very careful about those things. In adults also it can cause like strokes, okay, heart diseases, okay. In pregnancy it can develop problems to the fetus. So, those are the issues which are related to lead. So, we should be very careful that the environment in the air, lead should not be there, and we should do whatever is needed to have the air cleaner in that sense. Well, when we talk about particulate matter, so basically it is a mixture of solid, liquid, both particles. So, liquid droplets may be there, solid particles may be there of all size, very micro size which cannot be seen by eyes also, okay. Very fine particles, very nano particles may be there, okay. They can go inside our body system, and they can go into blood, as I repeatedly say. So, we should not take it very lightly. Particulate matter is very dangerous, and okay, suspended particulate matters, our nostril can exhale it, it can trap. This is a filter system nature has provided to us, but the small particles are very problematic, and we should be careful, like tire wear, resuspension of the dust, and the brake wear, those metals may be there in the particulate matter also, right. And then the sources can be of any kind of activity which is causing emission of particulate matter through burning of wood or fossil fuels or construction activities, vehicular exhausts, etc. You name it, even natural dust like andhi or storms, dust storms, they also are responsible for particulate matter. Only the difference is that their size may be higher, and because of gravity they settles down, but even then there may be very small particles also in that also, and that can go inside our body. And one scientist one day in a conference we were discussing, he said that in pre-industrial era, our population were exposed to these sandstorms etc., and there were no very high problem related to health. But now because of industries, the pollutants like metal pollutants or toxic pollutants, chemical pollutants, they can get coated on surface of the particulate matter, that may be very dangerous. So, the particulate matter and respiratory system of human is very much related to each other. So, you can see like PM10 can go up to this, okay, that may not be so health hazard, but PM2.5 can go up to the lungs, and PM1 more parts of the lungs can be affected. PM 0.1 can go into blood cells also, it can go up to the brain, and if those small particles are carrying some carcinogenic element, some very toxic element, that will be part of the body, and when it will trigger the cancer you do not know. So, that is why nowadays so many patients of cancer etc., it is because of pollution we are exposed to from different pathways. Of course, like food is also not so good, sometimes we are taking vegetables which were grown in dirty places. Similarly, water or milk or many ways you can get exposed to toxic material. So, you can see the size of the particles and the health effects of in the respiratory system, you can see in this table. Also this is a good example of different size of the particulate matter and related health effects. You can go like PM1, it can cause lung cancer, it can cause asthma exacerbation, and PM 0.1 it can cause even Alzheimer. Alzheimer, when people start to forget things and they can't remember even if they have taken food or not, that kind of things state happens in very old age. So, Alzheimer's may be caused by this PM 0.1 also, although these are as age related diseases, they are known as. Cognitive delays means your thinking ability, analytical ability will be affected, all those health effects are given here. Well, when we talk about PAH, polycyclic aromatic hydrocarbons, so they are emitted from several sources like these long range transport from industries etc., and burning of different fuel etc., you can have from coal, from tar sediments. Well, it has also several health effects. Short term maybe like vomiting, nausea kind of thing, you are not feeling well, eye irritation, skin irritation, those kind of things. In long terms it can cause these cataracts in the eyes, okay, and liver damage or kidney damage, that may be because of PAH also. So, polluted environment is not good to live, they can cause several diseases. When we talk about volatile organic compounds, VOCs, or even hydrocarbons they are known as, so sources may be natural as well as anthropogenic. As I said earlier that any plant which is giving some smell is basically emitting some VOC, volatile organic compound, you name it. It may be like even the spray which you use for room, that is not good for health. It gives you good smell, but it is chemical, it is VOC, it can damage your respiratory system, and many people have allergy to that. Anthropogenic, there may be industries, solvent evaporation, agriculture etc., and biogenic emissions are from plants, soil, vegetation, all those. So, VOCs may be emitted from those sources. When we talk about health effects of VOCs, again it is you name it, even including brain, heart, lungs etc., everything is affected by VOCs. So, VOCs are dangerous, we should not have VOCs in our air. Benzene, toluene, all these are VOCs basically, and they are carcinogenic, they can cause cancer. So, that is very toxic and very problematic. When we talk about dioxins, they are also very toxic elements, and they can be originated by industrial processes etc. So, we can get exposed to them through air and other pathways, and it can damage the nerve system, it can cause skin related diseases. Like you can see here, it is known that this president of Ukraine by opponents, he was given, it is said that poisoned by some dioxin, and it was later measured that around 1000 times more this dioxin concentration was found in his body. So, you can see the skin was damaged because of that high concentration of dioxin. So, in conclusion we can say that air pollution can have adverse health effects, as you know several health effects may be from different kind of air pollutants, and it depend upon the exposure, time, duration and the concentration. Okay. So, some may have less harmful effects, some may very high impacts, and the population in urban areas may be susceptible because more pollutants are there, and we have to be very careful that the air where we are breathing should be clean, otherwise it can cause several kind of health effects depending upon the pollutants. So, thank you for your kind attention. References are there for having additional information. You might be very curious about several health effects, you can go through them, you can know about. So, thanks for your kind attention. See you again in the next lecture. We will carry on impacts of the air pollution like on building materials or environment, ecosystems, etc. So, today we completed health effects, now we will go for other impacts. Thanks again.